Hello, this is Greg West, President of Healthcare Resource Group. Today I'm presenting a summary and overview of our complete business office solution. Thank you for attending. Let's talk a little bit first about who HRG is. We have been in business since 1994. We started out as a revenue cycle staffing company, putting staffing in hospitals. In 2003, we opened up our out partnering center in Spokane, Washington, and moved to almost a 100% out partnering outsourcing company. We have been known to provide the highest standard of service, and we work really hard at that. That's one of our missions, and we've been nationally recognized for our value and our quality. One thing that makes us unique, we are an employee-owned business. We're an ESOP. That means every employee is a shareholder of the business and has stake in how well we do for our clients. Currently, we have about 420 employees, and we really have a target market of the rural and community hospitals, although we do serve some of the biggest healthcare entities in the country. So we are, like I said, we are located in Spokane, Washington. Right now, our teams are not located at our headquarters because of COVID. We have teams that are actually spread out throughout the United States, with the biggest bunch of them in Idaho and Washington, right around the Spokane area. But we do have teams working remotely in Texas, in Georgia, California, all over the country. The one thing to say though is we are never offshoring. Everyone is US based. Our services include initial billing, account follow-up, editing the EDI system, collecting on self-pay, cash posting, policy review, denial management system, conversion assistance. That's really what we provide in our complete business office summary. We focus on a couple of different missions. Although we have some large PPS facilities, we really focus on critical access hospitals. We have a mission for native health, FQHC and RHC, and independent rural PPS facilities. One of our highlights of the CBO is our reporting. We have some of the best reporting in the industry that comes out of our Helix AI system, and that provides a great look at the last month, the last 6 months, plus cash future projections, your best potential AR. We track the unbilled, we do adjustment code, we do denial reasons and actions and the results of those actions. Just some of the highlights of the report. A lot of our people that report to, like our CFOs at our client sites, use our reports and take it to the board, and that's their board report because they're so well done. Why a CBO? Why would someone even need a vendor like HRG? One of the issues facing hospitals is financial viability, especially rural hospitals, but all hospitals are facing crackdown on reimbursement, harder to get authorization, more rules and regs. And so some of these problems that I have listed on the screen are common problems for every hospital. AR is increasing because you're having to do more with less. Your overall collection rates are lowering. The payers are getting tighter on it, and you're not finding as much of your underpaid as you should be. Age accounts, as your aging gets older, they get harder to collect, and many facilities have aging well over industry standards. The DNFB, with our coding shortage and trying to get people to be productive in the coding world, our DNFB is getting higher and higher, and the industry average has gone up. Also, staffing and getting people in the business office is really tough right now due to COVID and the mandates and the mask mandates. But even before that, hiring good qualified staff in rural areas has been really tough. And that's where HRG comes in. We provide that staff for you. Cash collections is inconsistent, which is a real problem. You have some high months, you have some low months. And what HRG does is get the billing on a regular pattern, work in a priority queue, and make sure your cash collections are consistent and you can count on them and they're actually projected. Community perception of the hospital, and especially the billing. A lot of rural hospitals have a poor community perception. And our job is to make sure your patients value the billing cycle, value the self-pay collection efforts, because we provide a service like we were providing to our own families. We're very patient friendly. We're focused on financial counseling when we do self-pay. We have cut our teeth on rural community hospitals, and that's how we treat all our patients in self-pay and our CBO services. People lose a lot of revenue due to documentation and coding issues, and we work hard to find those lost revenues. We also work hard to find the reasons, and educate you through reporting and education programs that we provide. One of the things I'm really proud of is HRG has pretty much eliminated untimely accounts. We eliminate those by our Helix AI system giving us targeted work queues. They score each account, and our reps work accounts based on the scores. So if something's getting closer to timely, it jumps up in score. High dollar makes it a higher score. But if it's something's untimely, getting closer and closer, it jumps over the high dollar so we can get that before it falls off the cliff. One of my pet peeves is having untimelies, and we have virtually eliminated untimelies for our 40 or so CBO clients. And last but not least, you get a lack of accurate reporting and payer management tools. Our payer scorecard is second to none. It gives you good information on how the payers are treating you, how fast they're paying, how many authorizations they're calling for, what their typical underpayment percentage is. That way you have a scorecard you can go back to when it's time to renegotiate the contract and let your payers know, hey, you're one of the hardest payers to deal with. I want more money from you. And that reporting is really valuable. The other regular financial reporting we do is, again, top notch. It provides everything you would want to know about your revenue cycle and more. And again, many CFOs use that to bring to their board and just share that documentation with them. So why would you use HRG with all those problems? Again, answer those problems and you have maximizing your cash and reimbursement, which is really important. Every dime in every hospital needs to come in so we can keep serving the patients. You want to minimize your cost to collect. We charge a very low percentage of collections and only collect when we collect for you in our CBOs. So we have the same incentive. We want to improve production and efficiency of your billing, and that's what HRG does, both with their training program for their people and our Helix AI technology. And we want to make sure, and really important to me, is that we enhance your patient experience. We are all patient focused, whether we're providing the clinical care or the financial care, and we want to make sure that your patients like the hospital when they've done with the billing experience. I've always said you can ruin a good clinical experience with a terrible financial experience, and our job is to make sure that doesn't happen. And then we want to optimize the system that you're using, whether that be CPSI, Epic, Cerner, any of those, and we've worked in almost every system imaginable, and our job is to make sure it's being used to its utmost and being used the most efficiently, and we're pretty darn good at it. Here's our business office results. We took the last 6 months and said, hey, what's our average results for our complete business office hospitals where we've been doing business for 6 months or longer. So new hospitals come in, takes us 3 months to really get things moving along like they should. So we took hospitals that have been with us 6 months or longer and took the last 6 months for the results. And our average gross days for the hospitals is 48 days. Our average net collections versus net revenue is 102%. Average denial rate is less than 4.5%, better than industry standard of 5%. Average percentage of AR over 90 days for our clients is 16%. And last quarter, I put it in red because I consider it a failure. Last quarter, for all 40 CBO clients, we experienced 5 untimely accounts, and those 5 accounts keep me up at night. And our goal is 0 every time. So our typical CBO processes, most of the time, we place an on-site consultant that does assessment, training, and helps you through the transition period. And then we take a look at the charge master and make sure it's up to date, there are current codes in there, and there's nothing lacking. Then we work with your team and build the processes and procedures so we get going, it gets going quickly, and we integrate our technology, the Helix AI technology, to make sure that we are getting the most efficient process out of what we do for you. Right when we go live, we take all your historical accounts and review for possible recovery. If they've been written off for denials, we look back, and then we do a big root cause analysis. So we can look at why have these been written off? Why have these been denied? And we can help you and the system optimize so those stop happening. And then we get going, we start billing out your claims, but together we implement a revenue cycle committee. We like to meet at least a couple times a month. Most of our clients, we meet once a week, where our director and supervisor of your revenue cycle on HRG side and your team that you have at your end, usually it's for front end registration and maybe an HIM director, depending if we're doing the coding or not. and some of your clinical people get together and we decide what's going right, what's going wrong, how do we fix it. And the whole idea is to fine tune it so we can get the best possible results for the long and keep them standard for the long haul. We want to do an ongoing review of your payer contracts and look where we can get increased reimbursement. We start the payer scorecards. We really start looking for underpayments and false denials and start helping you manage your payers. And then staffing, something we've really started new this last couple of years is we onboard any of your hospital employees that were revenue cycle that would be usually laid off by outsourcing it to a vendor. We like to interview and hire those people. One, they have experience in your system, and two, it helps us have staff that's already trained that we can now put through the HRG training and make them really good and efficient, and they know Helix really well. That also helps us have backup coverage. The one thing with HRG, we have the bench strength, and you'll see that in our ads. You never go without. So if we lose a person goes out on a maternity leave, you're not waiting 2.5, 3, 4 months to get that position covered. We have people step right in, whether that's people from the field who come in and help us, or we take people from another project that's ending and put them on your project. But we always have backup staff ready to go, so we never have the gaps like you would at the hospital. So let's talk about what CBO clients from HRG gain. One, they gain a certified revenue cycle director, supervisor, and a team. So we have a dedicated team that's going to be dedicated to your project, run by a revenue cycle director. Our team consists of a vice president of CBO who watches over all our projects, a senior director who watches over half the projects, and then a director who has 2 or 3 projects, a supervisor who's dedicated to your team, and then your team that only works on your project. That's what you gain from going with HRG and the people. Those people, again, now the COVID's hit, are mostly remote and they're working from home. They work in Helix, which has a production and quality assessment. So we know they're doing the work and they're doing well. And then we meet regularly and go over like their QA, how are they doing? Our on-site director that comes to you takes the first 30 days to complete an assessment and assist with the transition. That way we know what we're getting into. If there's any hidden things that we unpeel, that on-site director helps us and helps your people that are there still, whether that's in registration, clinical areas, HIM, help them work together on our communication so we don't have any gaps in performance. Again, I mentioned our bench strength, so we have no gaps in staffing coverage. And all our staff is monitored and scored monthly, and they must retain a 95% accuracy or higher. And then we have training programs if they fail or show even at 95, but we see some specific things that they're not doing correctly, then we go through a full training program. Our processes are all set up so they're documented. We use best in business processes and integrate our Helix AI. So for everything, any billing, follow-up cash, we have an extensive process that Helix AI helps us out with. We do have extensive payer experience in every state. Right now we're in 33 states out of the 50, and we've been in 48 of the 50 as far as doing work and know those payers really well, know every state's Medicaid, and we have Medicare experts that are second to none. We always implement best AR metrics when we first start, and we take a look at your facility, your payer contracts, look through historical denials, and then come up with this is the best AR metrics that we're going to get you to, and we create goals along the way. We create weekly cash projections so that you know every week, here's what the next cash is, and the CFO can start projecting cash. We do monthly claim and denial trending reports so you know what's going on there, and it helps us also get those fixed so we can lower those down to below industry standards. We talk about payer scorecards, and then we do Medicare bad debt tracking for your cost report and bad debt reconciliation, which is a help to the financial team left at your facility. I mentioned Helix AI is our technology. Your system, whether that be CPSI, Epic, Cerner, is still the system of use. Helix AI is our system here that we take that data from your system, put it into, it creates targeted workflows, does claim status with all your payers, does automatic eligibility. It really gives us a foot up on a lot of manual work that would normally be done. The Helix AI does that, and then gives the reps their work queue so they work them in the proper order and we eliminate the untimelies. We eliminate not looking at high dollars. Those kind of things are eliminated. We have a client portal for real-time transfer. So we build a client portal for you, and any data we need back to you or data you need to share with us is given through that client portal. We have the database Helix again is integrated. It's a daily upload and download of information back and forth into the system of record, which is your patient accounting system. And then we do high-level overview of the charge master and maintenance. So we run it through our program every 6 months to make sure your codes are up to date, that there's nothing nothing doubled, and everything looks up to date. It is not a full charge master review that you would hire and have someone come in and do every 2 years and really go through the charge master and with your clinical departments. We do the maintenance of it. So this is our distribution of responsibilities for our normal CBO. And you'll see, patient access management, the only thing we do there is provide you reporting back where errors are happening and denials created at patient access, but that stays at your responsibility level. Then from bill drop on, then it becomes HRG. Right in the middle of the screen is coding. If you hire us to do your coding as part of the CBO, then we take on coding, and that's our responsibility. If you'd rather keep coding in-house or you have another vendor, then that moves over to yours. But HIM management right above that, except for coding, is always the client's responsibility. Charge master maintenance, we show it as a split responsibility because we do that every 6 months, take a look and make sure it's updated. And we also, upon your request or changes in the industry, we'll do those periodic updates. And then you're required to do the deposit preparation. We don't want to touch your cash. The cash comes to you. We don't change that. But then we post the cash. And then we take on the self-pay management, where we send out statements, we do the phone calls, we take inbound calls, and the early out self-pay. And really, again, that's where we treat your patients like they were our moms and treat those with financial care to make sure they have a good experience. This is our slide of our implementation. So once we have a signed contract, then we go live in 30 to 45 days, and our implementation director, Andrea, comes in and does a kickoff call with you. The sales team that sold you will introduce you and introduce our team, and then we go through the expectations and what you're expecting and what we can deliver, and make sure we're all on the same page. We set up the regular meetings, and then we really get going on it. And at go live, there's a formal handoff from Andrea, the implementation director, to the operations team and says, hey, as of today, we are going live, and here's the team that's going live with you. And from then on, we do a weekly revenue status report and a monthly meeting, and we go from there. Again, we mentioned self-pay, and I think it's important enough because this is where we contact your patients, and that relationship is so important to hospitals. But we want to make sure we do it right. Our self-pay solutions is strictly health pay. We have both CBO clients we do the self-pay for, and large hospitals and independent hospitals that we just do self-pay for. We, again, have a great total quality assurance program. We listen to the calls, we record the calls, we look at the actions taken by the rep and grade those, and they're required to keep a 95% correct rate, and also some production standards for them. We have a very hands-on, human-friendly patient financial counselor approach. We do not have robocalls. We make sure that we have the human touch available. We do have text to pay and many other type of payment programs, but we do want to make sure that those people who want to reach out and get help, and we don't help them only with, hey, your bill is due, pay it. We help them with, hey, this billing looks incorrect. Let me look at your Blue Cross and see what we can do about this so it's correct, and then we'll get back to you. And all our people are AR trained financial counselors that can help with that. One of the things I'm really proud of is our speed to answer is second to none in the business. Our standard is 50 seconds or less speed to answer. Most call centers have a 2-minute, and if you've ever waited 2 minutes or longer on the phone to pay money, that's ridiculous. So we have a 50-second or less standard that we stick to, and when patients call, they get answered quickly, they get communicated, and then we have standards to get them callbacks and answers back. Again, with self-pay, you get very robust reporting, what's in self-pay, what status it's in, could be on hold waiting for insurance answers, it could be in bad debt, and we tell you where it is every step of the way, and you can have that report anytime you want it. We're really proud of our exceptional patient service, and I feel personally that giving that great service and that financial counselor approach will help you maximize, will help us and does help us maximize collections. And then everything we do, whether it's self-pay, any business we do, we take a very partnership approach with our clients. So we want to work with you. We don't come in and say, this is how it's going to be done. When we first implement, we sit down and say, what are your collection policies and how would you like to improve them? Or do you want to keep them the same? Do you want a discount program? So we don't come in and force anything on you. We want to build a great partnership approach that's best for you and your patients. We have metrics in self-pay, the quality assurance score. I mentioned the average speed to answer. Currently, you see it's at 41 seconds. We have a very low abandon rate in the industry. Then we have a reduction of how many calls per hour. We do not have the average handle time where we really say you have to talk to somebody and get off the phone in 2 minutes. What we do is we want to make sure you're handling that patient so they're feeling good about the call, they're done with it, and they don't feel like they need even more explanation at the end. And then we have a software that monitors the talk of the call, and it will flag a supervisor if there's certain words mentioned, if the hostility level starts going up with the patient, then we have a automatic over to a supervisor. I'm proud to say that since we bought that software, it's hardly been used because our reps are so well trained at how to handle patients, how to handle angry patients, how to deal with people in tough situations when they have healthcare problems and money problems, and how to walk them through that. And that's really important. All right, to close our conversation about our self-pay, let's talk about our self-pay technology. Helix AI, of course, is our technology that runs all our business, but we use that for our self-pay representatives that complements the existing patient account system. It also helps manage the workflow. It makes sure that calls are done in a rotating basis, so we'll do outbound calls during the day, into our evening hours and our Saturday hours, and then make sure all the notes get back into the patient accounting system of record. We also have a patient experience customizer. It allows you to choose the level of detail you want to provide on statements and provide that unique look and feel. So the statements will have the picture of your organization on it and your logo. And then we can customize that statements to put as much detail as you want or as little detail. And believe it or not, there are some industry standards that we recommend, but believe it or not, every hospital has a different standard they want to follow. We also provide a patient concierge type solution. We allow the patients to communicate through phone calls, text messages, emails, pay by phone IVR. Then we still do the paper statements and electronic statements. So whichever way you want to communicate and pay your bill, we allow that to happen. We make sure that we're following the rules and we verify contacts, and we also have a mail return that we chase down mail returns very quickly and do skip tracing to make sure we can get to the people. I talked about the voice optimizer that records the calls and also listens for specific tones and words, and will flag the call to go to a supervisor for increased coaching. Our patient portal that we can allow you to have is set up to do all those different payment types and give information to the patients. We know that Epic has a patient portal, and many of our Epic clients choose to remain on that portal and not use ours. But for smaller, independent, and rural hospitals, we have a very similar portal that does a great job for patients and gives them all kinds of accessibility into their look and feel of their statements and how they want to pay, how they want to communicate. We also do eligibility through a bot with our Helix AI and go through the Medicaid and many of the other payers to make sure they're not eligible and we're truly, in fact, supposed to be collecting in self-pay. And then our data control really makes sure that there's secure transmissions of data back and forth, and that we have a good count, that records don't get lost in the flow and go into the black hole, that we have a really good count of how many records are coming from you and how many records we got, and we reconcile that on a daily basis. So I want to talk a little bit more about our technology, our Helix AI functions. For our representatives, we do that account prioritization. We call it targeted work queue, and it already performs an eligibility and claim status, and that eliminates the touches that don't need to happen. So when we're touching it, it's already scored and says, this is the most important account you can touch at this moment, and we get it resolved. It's a great program, a great system that Helix AI does. We have follow-up notes that are already uploaded to the client system, or follow-up notes that are already built that makes it easier, and those are uploaded to the client system. We have communication log that goes back and forth between the client and HRG to make sure that we're communicating clearly and crisply, and that all communication is recorded and we know exactly where we stand. We found in the old days when we were just using emails to communicate back and forth that missed emails and were causing gaps in performance. So we built these communication logs to track and keep the communication. We also have the Helix AI Vault where we can store attached documents. So when we need documents from your medical records or for labor and industries, the Helix AI Vault will keep, and we easily get those records back. And then the Helix AI also sets account status, action, and follow-up dates. Again, that's kind of the targeted work queue, and it keeps the policies and procedures that we built with you at the rep's fingertips. So everything they need to work an account in your patient accounting system is at Helix, and Helix makes it easy and also handles a lot of the assignments, a lot of the mundane tasks like eligibility and claim status that our reps would be sitting on the phone to make. For our managers, it's really about workload, not having to manage every rep every day looking over their shoulder. So Helix AI distributes that workload. It does the great reporting. It does monitoring. It also does our productivity and our QA support. And the biggest thing for our client is the issue tracking. One of the best things we can give a client, whether it's EBO, CBO, self-pay, is when we get old accounts, is we go through those and track the root cause and why they're still there and not paid quickly and what went off. And then we give that feedback back to the client or fix the system in a CBO, train our reps to do things a little bit differently if that's what caused it. And that root cause really creates some of the quickest improvement with our clients. Real quick, we didn't give specific pricing, but we charge a percentage of collections for CBO services. SNF is one low price. Inpatient is a little bit higher, outpatient then starts ratcheting up a little bit. Clinic is a little more expensive, and then a separate amount for self-pay is self-pays included. If our coding is included, we separate that price out, and it's either hourly or per chart. A couple of our clients have come back and said, I want coding, I want all the above, the SNF, the inpatient, the self-pay, the clinic, but I want it one rate. And so we can blend the rate if that's what a client really wants. We want to protect the client, though, to make sure that we're not gouging the client by charging too much for, let's say, inpatient, which is larger dial, easier to collect, which is why we separated those up. So we are flexible in our pricing. Last but not least, I really want to mention our constant commitment to quality and how important that is. We have the Helix that really drives the performance, the technology, and our productivity, but we still are a people-driven business serving patients, and that's why this is so important. So we want to make sure everything is really revolved around our employee owners and make sure they're getting trained and growing, and that we give them constant training to keep up with the industry, keep their skills. You'll notice in training it says formal soft skills training. That's so important when you're dealing with patients, that we have that soft skills, how to diffuse a situation, how to talk a patient through a heartbreak. There's all kinds of training that we give in those soft skills. And then we have a formal step and range training program. So there's always growth and a future for our employees. We've been nominated and awarded great places to work in several industry magazines in the Pacific Northwest, in the Washington State. And one of those reasons is we provide a way for our employees, owners, to grow and become supervisors, directors, vice presidents. And if you look at our org chart, a lot of our people in those executive ranks now have come up, started as reps and worked their way through. and went through the step and range program and the training programs we provide. We constantly communicate issues with our team. Every team has weekly meetings to talk about what's going on and what issues they found and how we can improve that and make it better. We also talk about what went right and how we make sure that becomes a habit. And our TQA program, really second to none in the industry. We do weekly call scoring, also for our TQA for our reps, weekly account scoring. We want to make sure the patient experience, customer service is the focus. And then with a lot of TQA programs, whoever performs your TQA, you get a good score, bad score. We make sure that all our leadership does calibration with our TQA people, so everyone's getting a standard scoring system, and we're looking at accounts the same no matter who's doing it. So we meet regularly to calibrate our TQA and make sure that everybody is getting a standard score. And then our performance management really is about the TQA and the production. We do real-time team statistics on a monitor every day. People know how they're doing. They also get a monthly balance scorecard with a review and bonus programs that are built into that. And then every year they get their annual 360 review with peer review, management review, and their own review, and blended together. So again, it's all about growth for our employees and making sure we're doing the best possible work for our clients. I'm going to end with our accolade slides. This is, things that I'm really proud of. Best in class in 2019, one of the top rated coding. I think we're actually classified as third, but they gave us the top rated coding. 2019, best extended business office in 2019. This year we also placed highly. More than that, I'm really proud of the best places to work. You'll see the Inland Northwest has gone from 2016 to 2021 consistently. This year we were number 3 in large company categories, best places to work in the Inland Northwest, which is Spokane, Eastern Washington, and Northern Idaho, and really proud of that. Mountain Healthcare has recognized us as the best place to work, and we've also been recognized as the top performing and a largest revenue cycle firm, and we're very proud of those. And so those are our accolades over the years, and again, that just shows that HRG has been providing top quality service, and more important, a top great place to work for our employee owners. Well, that's a summary of our CBO and HRG in a nutshell. Thank you for viewing this, and hope to talk to you soon. Thank you.